Thank you so much. A nice introduction, and I'm very proud of my students here supporting me. Thank you for coming. So our study that we did, and I'm reporting about, is about the culture of safety in nursing home. And I would like to. This study was supported by an internally grant from the University of Louisville, and I thank my students who helped me in the research office. Uh, Chris Hannon is a student. He's now in the DMB program. Jessica Jones just graduated, but she helped us with that project. Culture of safety. You cannot talk about patient safety without talking about a culture of safety. We always do projects, but these projects live for the time of the project. We need a true culture of safety that's a core element for a true patient safety practices in healthcare, and especially in long-term care. An effective and a positive and a just culture of safety will provide more motivation and more commitment and more satisfaction and more productivity from nurses and all the healthcare work team. Now we're talking about nurses, but a culture of safety includes everybody who's working in the healthcare system and providing bedside care to the patient. Physicians, social workers, aides, nurses, LPNs, RNs, anybody who is in close contact in that healthcare system with the patient needs to be part of that culture of safety. A culture of safety includes many elements. It includes teamwork. We work as a team, supporting each other, working together. It also includes an appropriate staff rate and mix. And there is a huge literature from Dr. Aiken and many researchers that says the more RN hours, the more nurses hours per patient, the more positive outcomes for the care process. The less mortality rate even. So less mortality happens because we have appropriate nursing staff. The response to mistakes, how we respond, non-punitive response to mistakes. The system has been built upon fear. If somebody makes a mistake, they're so scared and they try to cover up because they're scared of the consequences. We need to develop new ways, of non-punitive ways to deal with mistakes. They happen. We are a human. And the IOM report that Surgeon General talked about is famous. And it talks about all that care errors and the number of people who die. About 100,000 people die every year due to care error. And we're human and we make mistakes, but we need to deal with that in really more professional, positive way, trying to deal with the systems. And most of the mistakes and error happen why? Because of the nurse, because of the doctor, because of the healthcare professional? No. The research shows that most of these errors happen because what? Because systems error. The way we design work, how our flow sheets happen, about procedures, systems, so we need to develop those. Communication is a big topic in patient safety. Effective communication is always related to better patient outcome and less mortality. And we fail to communicate in the healthcare system together. The pharmacy, the social worker, the nurses, the doctors, we're not doing the best job of communication to each other to help our patients. Leadership, and all these are components of a culture of safety. Creating a healthy environment contribute to promoting optimal care for our residents and a healthy environment for our staff and for our nurses and our healthcare team. Toxic workplaces. And some researchers went so far to study toxic workplaces and environment and cultures. And what they found? The more toxic the health care environment, the more stress for the nurses and the healthcare work team, all the team. The more sick leave, the more turnover. You go to some of these nursing homes and the staff is all new. And some of these nursing homes do not have a staff even. And the most common job available in the area I am in is a director of nursing for a nursing home. We can't even have people who accept even that position anymore. It's very hard. So we don't want to be in toxic workplaces. Adverse events in long-term care facilities and nursing homes. We have 1.6 million Americans reside in 18,000 long-term care facilities. Studies document high rates of adverse events in long-term care facilities. What are the main errors or mistakes or adverse events in long-term care facilities, nursing homes? Number one is which one? Falls and pressure ulcers. The most common ones are falls and pressure ulcers. And when we talk about prevalence, the studies are so, the numbers are so wide. From 6 to 25%, the pressure ulcer range, the prevalence, and it depends on so many factors. If we talk about falls, 1.7, the fall rate is at 1.7 per bed, with 10% to 25% of the people who fall sustaining life-threatening consequences, many end in death. Lower adverse events and lower mortality rates been attributed to appropriate RN ratio in healthcare organization. We talk about communication and we still don't have it. And in this environment, we thought we need to look at the culture of safety and the adverse event in long-term care. And that's our goal for the study, to want to assess the scores for the culture of safety and look at the elements and the dimensions of culture of safety, including communication, leadership, and we wanted also to compare those with the adverse events in nursing homes, including falls, UTIs, and pressure ulcers. And our study aim again was to predict adverse event. Would a culture of safety scores predict adverse event in long-term care? Would better leadership, for example, decrease adverse event, decrease fall? We wanted to investigate that. We also wanted to look at the scores. We want to see what are the scores in this area for culture of safety. What are the scores for adverse events, for pressure ulcers? What are the scores for UTIs? What are the scores for falls? We wanted also to look at evaluate the relationship of these selected adverse events with staff turnover, staffing, director leadership style, and communication. And for our study, we used a cross-sectional design, and we did secondary data analysis. So we used a survey from the AHRQ, the Agency for Healthcare and Research, Culture of Safety Research Survey, and we used the data from the Nursing Home Compare website by the Center for Medicaid and Medicare. And our sample was 5 nursing homes. We actually called all the nursing homes within a county, 70 of them. And only 5 of them agreed to participate in our study. And that's our sample size. That can tell you, research is not that popular in nursing homes, really. And everywhere we went, people were surprised. We're glad to see you. You're doing research. We don't see many researchers coming over. So that was a positive thing that we went to this environment. And of course, culture of safety include all the healthcare workers, and I list them here: the RN, the LPN, the nursing assistants, the social worker, the physical therapist, and the occupational therapist. And we had our researcher and our students who helped with that study. We trained them on conducting the research, and we visited the nursing homes, and we prepare a packet, include the preamble to describe what the study is, the survey, and we put it inside an envelope for confidentiality and anonymity. So nobody, and we told them, do not write your name on the survey. We want it confidential and anonymous, and feel free to answer this to the best of your knowledge. And we gave them refreshments. We had Subway sandwiches, and we gave them that as a thank you for them completing our study, our research. And hopefully that was good. And these are the subscales for the safety of culture of safety survey: the teamwork, staffing, compliance with the procedure, training and skill, non-punitive response to mistakes, supervisor expectations, hand-off reporting, feedback and communication, communication openness, and overall perception of resident safety, management support, and organizational learning. Our findings: 211 care person completed our survey. 27% of the sample were licensed nurses. Nursing assistant were 35%, the largest number of the sample size. Managers, administration 8%, administrative support were 3%, and rehab staff at 13%. 98 participants, 46% worked overtime. So too many people work overtime in the nursing home in our state. The majority of participants were neutral, neither agreed nor disagreed with regard to statements concerning compliance with the procedures, adequate staffing level, and non-punitive responses to error. And this table shows you the correlations between the short stay ulcer, long stay falls, long stay UTIs, long stay ulcers with other components on the other side. And if we look at them, I like the most important ones at the bottom. We can see teamwork, for example. The more teamwork was there was a statistical significant relationship between teamwork and more teamwork and less short stay ulcers, less falls. So the more teamwork, the less falls, the more teamwork, the less ulcers. The same thing with reporting. The more hand-off reporting at the end of the shift, or reporting in general, the more reporting was statistically has a relationship with less falls, long stay falls. And the same thing for organizational learning. The more organizational learning, the less falls. The highest mean and the culture of safety scores were feedback and communication. So they said that they are communicating really good at 4.35, a score out of 5. And the mean supervisor expectation and action promoting patient safety, resident safety was 4.03. And the mean score overall perception of resident safety was at 4.24. The score were high relatively for the culture of safety based upon the staff working in nursing homes. And I talked to you about the correlations in the table. Now we ran, let me go to the next one. We ran a GEE equation model, generalization estimating equation with a Poisson distribution to predict rate of care errors. And this is a nice table and nice findings here in our study. If we look at the hours, the more RN hours were associated with a relative risk for 0.12, and that actually can go back here and we can look at the numbers of RN. There was the relative risk, decreased risk of fall by 79%. So as the number of RN and LPN hours per resident increased, the rate of fall decreased, the risk for it, for 79%. This is a very significant finding, really. The same we look at the culture of safety score. The more the score increased, the risk for fall decreased at 26%. The UTI decreased at 20%. And the short stay ulcer decreased at 7%. The relative risk for those decreased. So the more safety culture scores, the less adverse event risks for our resident in nursing home. And this is a very significant finding. It shows that a culture of safety is paramount in real, and we're giving you here numbers of how much the risk decreases for falls, for UTIs, and for ulcers, pressure ulcers. And we also suggest to develop more interventions to improve culture of safety in nursing home, and we also suggest maybe a CASPE program in long-term care would be a wonderful achievement to decrease adverse event in long-term care. Any questions? That's our finding for our